Hey everyone, I wanted to do something a little bit different today and do a bit of a case report. I had been working with this really fun client, really motivated runner, been running for years, and he had developed some lateral knee pain, and it was some IT band insertional knee pain. And we'll see in some of these videos that I have kind of string together here why he was developing that, how it manifested. That pain could have, based on how he was running, could have manifested in other places. In this case, it just happened to manifest as that kind of IT band insertional pain. But this is a great case report in, the power of exercise. And we pretty much, because of timing, the only intervention we did was give him a home exercise program. And he went home and he worked hard on it. And the before and after video are a couple months apart, but it's really noticeable in how well his leg is tracking. And we'll pay more attention to it here in the videos that are attached, but you'll see that his left foot, the toes are pointed pretty far outward externally. And after some cueing, some motor control, some exercises at home, he is tracking really straight with that left foot after a couple months. And that, of course, is significantly correlated with him running much further before any onset of pain. When he first came in, he was probably running about 2 miles before he started to experience some of that lateral knee pain. After this home intervention, he was up to about 6 or 7 before the onset of that pain. So he still had a ways to go because he was motivated to end up running long-term goal about 50 miles a week. And you'll see that, even in the after video, there's still some work that needs to be done. He's got a little bit of a medial heel whip coming through on that swing phase. But again, and we can't be certain of this, but presumably he was running in this pattern for years before. So, if you're stuck in a movement pattern, it's going to take some time, especially if it's been there for years, to kind of break that habit. But 2 months of him trying to change that pattern, and it's already looking much better. That's a pretty good turnaround time, given that it could have been going on for 5, 6, 7, 10 years. So yeah, we'll talk more in these videos that are kind of strung along here. So let's get started. So this is the before video of him running, and this is an angle from behind. And what I want you to see is that in the left leg, the toes are pointed more out to the side. So his hip and his tibia on the left side are more externally rotated, and he never really gets that end range internal rotation. And you can see as he swings through on the left, how the toes are kind of pointed out to the side relative to the right, where the toes are more up and down. He lands on the right with the toes pointed straight ahead. And on the left, he lands and the toes are kind of pointed at maybe about a 20-degree angle out to the side. Now again, he kind of developed this left lateral IT band insertional knee pain because his left TFL and the anterior glute med were working really hard, kind of stuck in that external rotation, trying to provide stability to that leg as it was swinging through. You'll see on the front side that there's just a little bit of what we would call a dynamic knee valgus, where there's kind of a little bit of if you're looking from the outside, a little bit of concavity there within it. The knee is kind of in relative to the hip and ankle. So this is the backside view, and it'll be more obvious with the toe out on the front side view here. All right, so we'll go to that. So this is the front view, and this should be a little bit more obvious in terms of what I'm talking about here. So if you look at his left leg, if you look at the shoe, you can see that as he's landing on the left, his foot is externally rotated. His tibia, his hip are externally rotated, and his toe, that shoe is pointing out to the left more, out to the side. Compare that to the right when he's landing. That shoe, those toes are all pointed straight ahead. And they should be pointed straight ahead. They should be tracking that way if we're running. So his left hip is not getting internally rotated. His tibia stuck into external rotation. And that lateral, in his case, because it could have manifested other places, that IT band insertion is being irritated on him because his TFL and his glute med are so tight on that side. Now, having seen the before video, let me tell you what we started to work on. One, we needed for him to be able to access full hip internal rotation. So that meant we need to work on some of his ability to get there. We did that with a combination of kind of active mobility work. He would use that as a warm-up, kind of like some side sit swivels, little rotating pigeon, kind of side sit get up. We had him do some static stretching, particularly at night, because I think that sticks better. And we had him working on some pigeon, cow face pose to really unlock some of the hip muscles that needed to learn how to lengthen. So we did those things kind of from a mobility perspective, and then we really worked on kind of hammering his medial hamstrings, his adductors, particularly adductor magnus, and being able for him to control the length of his hip external rotators so that they could eccentrically allow him to get into internal rotation in that left hip. And so that was a theme, that was kind of the theme that we were working with through his home exercise program. And I'll show you a couple of exercises in video of specifically what we had him working on. Don't have all of them on video here, but just a few just to kind of highlight. But that was his theme. And after these videos, these exercise videos, I'll show you the after videos of him just after a couple months, and you can really see how improved that foot tracking, that leg tracking is on that left side, and kind of bonus, how much more vertical his leg is, his femur, his tibia. There's no dynamic knee valgus during that stance phase. So so you guys can see that in the after video there. So let me show you a couple of exercises that specifically that we worked on, then we'll go from there. So this is one of the exercises that we had him working on. So one of the things that he needed to work on was to be able to access his full ability to internally rotate that left hip. Now he actually there was no joint restriction there. So he actually had the ability through the joint to rotate fully internally, but his muscles hadn't really learned, particularly his hip external rotators, hadn't really learned how to lengthen into internal rotation. So he was kind of stuck in hip external rotation. So we use this exercise to retrain those muscles, those hip external rotators, how to lengthen under load and then contract under load again. So this was one of the things that we had him doing from the hip standpoint. And there are other things we had him working on kind of further down the chain there. But this was a big one for him. And that's from the, getting that access to that hip. So here's an example of another exercise that I gave him. We're using the block between the legs to really encourage that adductor and medial hamstring activation. And this video doesn't show it completely, but we could even space the feet out a little bit wider and really try and bias those femurs into internal rotation, which is something that I worked on with him. Now this is the after video from the back, and you can still see that he's got some stuff to work on. So he's still got that medial heel whip as he's swinging through. So you can see his toes are still kind of pointed outward as he's swinging through there. But in the stance phase, when he lands on that left side, you can see how much straighter his left toes are, how he's pointing straight ahead, and how straight vertically his left leg is. There's none of that valgus anymore. It's straight up and down. So this is the after video from the front, and you can see how straight those toes are tracking on the left during the stance phase. and how vertical his left leg is now. He's taking all that force vertically through his leg. There's none of that kind of little dynamic knee valgus that was going on there. And overall, this just looks like a much more efficient run. So we can see with these before and after videos, really the power of doing some concentrated motor control, strengthening, mobility exercises that really target a particular deficit. And again, this pattern that he had developed was probably going on for years. And within a couple months, he's really been able to improve how that leg is tracking, how vertical his leg is, very little dynamic knee valgus going on there, significant improvement in how far he's running. And so this, again, as we noted in some of those videos, still some work to be done, but the progress is really going well. So I hope you guys enjoyed that, and let me know what you think.